Yeah, I'm presenting the overall survival results of this randomized phase 2, looking at the combination of Relacorilant with Nab-Paclitaxel in patients with platinum-resistant and refractory ovarian cancer. This was a randomized phase 2, which 3 arms. One arm was the standard arm of Nab-Paclitaxel weekly. Then we had one arm of Relacorilant given continuously, low dose continuously, and the third arm was Relacorilant given the day before, the day off, and the day after chemotherapy. So we included 178 patients, and we presented already the primary endpoint, which was the progression-free survival at ESMO last year. And here at ASCO, I'm presenting the overall survival data. So we already demonstrated an improvement in progression-free survival for the use of the intermittent Relacorilant with Nab-Paclitaxel compared to Nab-Paclitaxel alone. And here I presented the improvement also in overall survival with a hazard ratio of 0.67, which did not reach the statistical significance, but we realized that in the intermittent arm, the number of patients with primary platinum refractory disease was overrepresented. So we perform a subgroup analysis by considering only patients without primary platinum refractory disease, and in this population the hazard ratio for overall survival was 0.63, which statistically significant. So I think it's very encouraging, also because the curves start separating around 6 months, and then they remain separated over time. And you see, for instance, at 2 years, 27% of patients in the Relacorilant arm were alive, compared to only 14% in the control arm. The other thing I want to say is about toxicity. We demonstrated that the addition of Relacorilant to Nab-Paclitaxel did not increase toxicity, so the tolerability was quite good. The main side effects in neutropenia, which was of grade 3 only in 6% of patients. There was no febrile neutropenia, no increase in nausea, fatigue, or neuropathy. All patients in the Relacorilant arm received prophylactic GCSF. So overall, we are very happy with these results, and actually, next step will be to run a prospective randomized phase 3 study. We will randomize 360 patients to receive the Nab-Paclitaxel plus Relacorilant versus physician choice chemotherapy between pegylated liposomal doxorubicin, taxane, Nab-Paclitaxel, or topotecan. And the primary endpoint will be progression-free survival by independent review, and overall survival will be a key secondary endpoint. It has been shown that cortisol may contribute to chemotherapy resistance because it can interfere with the apoptotic pathways which cytotoxic agents such as Nab-Paclitaxel utilize. So basically, Relacorilant is a selective glucocorticoid receptor modulator and compete with cortisol at the GR, the receptor, so that can block the anti-apoptotic effect which cortisol has. And it has been demonstrated that in ovarian cancer there is an overexpression of GR, the glucocorticoid receptor, and therefore that's why, of course, ovarian cancer may represent an ideal disease where to assess the efficacy of this combination. Yeah.